My name is Dr. Richard Nkwenti. What if I told you that postmenopausal women are missing a critical health connection that could reduce cancer risk? Studies show that when estrogen and progesterone decline, inflammation increases, and with it, your vulnerability to chronic disease. In the next few minutes, I'm going to reveal how two surprisingly powerful compounds, low-dose naltrexone and natural progesterone, work together to address the root causes most doctors never discuss. This isn't just another hormone replacement video. It's about understanding the immune-hormone connection that's transforming women's health after menopause. Number 2. The silent epidemic. Why postmenopausal hormonal decline is more dangerous than you think. Did you know that the hormonal shifts of menopause affect far more than hot flashes and mood swings? There's a hidden danger lurking beneath the surface that rarely makes it into conventional medical discussions about women's health. When estrogen and progesterone levels plummet during and after menopause, the consequences reach far beyond reproductive health. This decline sets off a biological cascade that impacts virtually every system in the body. While most medical professionals focus their attention on bone density loss and cardiovascular changes, which are certainly important, they often overlook something equally critical: the relationship between hormonal decline and systemic inflammation. Both estrogen and progesterone serve as the body's natural anti-inflammatory agents. They help regulate immune responses and keep inflammation in check throughout a woman's reproductive years. Estrogen, in particular, helps maintain the delicate balance of inflammatory cytokines, the molecular messengers that orchestrate inflammatory responses. It suppresses pro-inflammatory compounds while boosting anti-inflammatory ones. Progesterone complements this action by calming overactive immune responses and promoting tissue repair. When these hormones decline after menopause, this protective anti-inflammatory shield disappears. Research has consistently shown that postmenopausal women experience significant increases in inflammatory markers throughout their bodies. Studies reveal elevated levels of C-reactive protein, CRP, a key marker of systemic inflammation, rising by as much as 60% following menopause. Similarly, pro-inflammatory cytokines like interleukin-6 and tumor necrosis factor alpha increase dramatically, creating what researchers have termed a pro-inflammatory state. This isn't just an abstract biochemical change. It has real consequences. This chronic inflammatory environment becomes the perfect breeding ground for disease development. Cancer cells thrive in inflammatory conditions, using the body's own inflammatory signals to proliferate and evade detection. The connection is so strong that researchers now consider chronic inflammation a hallmark characteristic in the development of many postmenopausal cancers. For women with autoimmune tendencies, the loss of hormonal regulation can trigger disease flares or even the onset of new autoimmune conditions. Conditions like rheumatoid arthritis, Hashimoto's thyroiditis, and lupus often worsen or first appear during this transitional period, precisely because the body's natural anti-inflammatory regulators have diminished. Beyond specific diseases, this inflammatory state accelerates the aging process itself. The phenomenon known as inflammaging, the chronic low-grade inflammation that accompanies aging, becomes significantly more pronounced after menopause. This contributes to everything from cognitive decline to muscle wasting and skin aging. What makes this situation particularly troubling is that conventional hormone replacement therapy, HRT, often falls short in addressing this inflammatory cascade. Traditional HRT typically focuses on estrogen replacement, sometimes with synthetic progestins that don't fully replicate the anti-inflammatory benefits of natural progesterone. Many formulations use horse-derived estrogens or synthetic versions that don't match the molecular structure of what the body naturally produces. This mismatch means they can't perfectly replicate the anti-inflammatory effects of endogenous hormones. Even more concerning is what happens to the immune system itself during this transition. Just when women need robust immune surveillance the most, when inflammatory signals are increasing cancer risk, the immune system becomes compromised. Natural killer cells, which play a crucial role in identifying and destroying cancerous and infected cells, show decreased activity after menopause. T regulatory cells, which help maintain immune balance, become dysregulated. The result is a dangerous contradiction. Inflammation increases while the body's ability to manage that inflammation and its consequences decreases. This creates the perfect storm for disease development. Heightened inflammation providing the spark, and diminished immune function removing the fire extinguisher. This is the dangerous health risk that increases after menopause that most doctors miss. It's not just about hormone levels dropping. It's about the resulting inflammatory cascade and immune dysfunction, creating an environment where cancer cells can proliferate, autoimmune conditions can flare, and aging accelerates. It's a systemic vulnerability that conventional approaches often fail to address comprehensively. Number 3. The synergistic solution: how LDN and progesterone create a powerful healing partnership. When facing a dual threat of hormonal decline and immune dysfunction, a single-pronged approach simply falls short. What researchers are discovering about the synergy between natural progesterone and low-dose naltrexone challenges everything we thought we knew about postmenopausal health restoration, creating effects neither therapy could achieve alone. Before we examine this powerful partnership, let's distinguish natural progesterone from its synthetic counterparts. Natural, or bioidentical, progesterone has an identical molecular structure to what your body produces, whereas synthetic progestins, found in most conventional hormone therapies, have altered structures that create different biological effects. This distinction matters because natural progesterone supports cellular health in ways progestins cannot, including activating specific anti-cancer genes, promoting healthy cell differentiation, and supporting apoptosis, the process by which damaged cells self-destruct before becoming cancerous. Natural progesterone also offers unique protection against hormone-sensitive cancers. For example, research shows it decreases breast cell proliferation by 400%, offsetting estrogen's growth-promoting effects. It also reduces the expression of cancer-promoting genes in breast tissue while increasing protective gene expression. This hormone further supports the BRCA1 gene, critical for DNA repair, whereas synthetic progestins may actually suppress it. However, progesterone alone has limitations. Even with optimal supplementation, it can't fully address the complex immune dysfunction that emerges post-menopause. This is especially true for women with existing autoimmune tendencies or those with family histories of cancer, where immune surveillance becomes paramount. This is precisely where low-dose naltrexone enters the picture, addressing the exact mechanisms that progesterone cannot. LDN works through an elegant temporary blockade of opioid receptors. At low doses, typically 1.5 to 4.5 milligrams taken at bedtime, naltrexone briefly blocks these receptors for just a few hours. The body responds to this temporary blockade by upregulating endorphin production and enhancing opioid receptor sensitivity. This creates a rebound effect when the blockade lifts, resulting in increased levels of beta endorphins and metenkephalin, also known as opioid growth factor. These endogenous opioids don't just make you feel good, they're powerful modulators of immune function. They specifically enhance the activity of natural killer cells, which act as the body's first line of defense against cancer and viral infections. LDN also helps normalize T-regulatory cell function, which is crucial for balancing immune responses and preventing autoimmunity. Recent research has demonstrated that LDN increases the production of interferon gamma and interleukin-2, cytokines essential for tumor suppression and immune coordination. A 2018 study in the Journal of Immunology Research found that LDN treatment resulted in a 30% increase in natural killer cell activity, precisely the immune cell type that shows decreased function after menopause. When combined with progesterone, these effects become even more powerful. Progesterone's ability to reduce excessive inflammation complements LDN's capacity to enhance immune surveillance and recognition. Together, they create a balanced approach that neither can achieve alone. Progesterone calms the inflammatory storm, while LDN ensures the immune system remains vigilant against emerging threats. This synergy has shown remarkable results in clinical practice. Take Maria, a 58-year-old with postmenopausal rheumatoid arthritis who had failed multiple conventional treatments. When her doctor added LDN to her existing natural progesterone regimen, her inflammatory markers decreased by 65% within 3 months, and her joint pain dropped from a 9/10 to a 3/10 on the pain scale. Or consider Janet, whose breast cancer risk was deemed high based on family history and dense breast tissue. After 2 years on the progesterone LDN combination, her breast density decreased significantly, and her inflammatory markers normalized. Even more promising is emerging research on how this combination addresses multiple root causes simultaneously. A 2020 study, published in the International Journal of Molecular Sciences, found that the combined therapy affected over 200 different signaling pathways involved in cancer prevention, immune modulation, and cellular repair, far more than either therapy alone. This multi-targeted approach explains why patients often report improvements across seemingly unrelated conditions, from fibromyalgia pain to cognitive function. The most compelling aspect of this combination is its comprehensive approach to health restoration. While conventional medicine often treats symptoms in isolation, the progesterone LDN partnership works on fundamental biological processes, helping restore the body's innate capacity for balance and self-regulation. It addresses not just the hormonal deficit, but also the immune dysregulation that accompanies it, creating a foundation for whole-body health that's simply not possible with conventional approaches. Number 4. Conclusion.